morning, welcome, and thank you for attending today's New to Medicare presentation. I'm Karen, and my co-presenter is Gloria, and we are Senior Linkage Line Specialists. Today you will learn the basics of Medicare and how to supplement that coverage. We welcome you to call the Senior Linkage Line anytime, Monday through Friday from 8 a.m. to 4:30 p.m. for more personalized counseling. So what is the Senior Linkage Line? Well, we're a service of the Minnesota Board on Aging, and we are housed within the 6 area agencies on aging that cover all 87 counties. We are a non-biased, no-fee service and do not sell, market, promote, or endorse any insurance products. Since 1993, the Senior Linkage Line has provided statewide comprehensive information and assistance. The Senior Linkage Line is a service of the Minnesota Board on Aging and the 6 area agencies on aging. This slide shows you where each of those agencies are located in Minnesota. The Senior Linkage Line provides services that are free. We provide services to any Minnesotan, and we are funded through state and federal dollars. We're neutral. We won't recommend one service provider or company over another. We want to give you options and help you choose what will work best for you. The objective is we will share all the information and help you make an informed choice. While Medicare and health insurance counseling are a major part of the Senior Linkage Line service, long-term care options counseling, care transitions, and helping Minnesotans age independently are services and values of the Senior Linkage Line. We help seniors with many facets of transition to and from their homes, the hospital, a nursing home, or assisted living facility. Community living specialists help nursing home residents and community members through the Return to Community initiative by writing community support plans, connecting to needed services, and providing rigorous follow-up. Long-term care options counseling is about providing education on housing options and services and supports needed to remain in the community setting of choice safely and independently as long as possible. The SHIP portion of the Senior Linkage Line services is volunteer-based, and if you are interested in volunteering, please call the Senior Linkage Line and ask to speak with a volunteer coordinator. Connect with us. If you need help, the Senior Linkage Line is there for you. We can help you by phone, in person, online, and by chat. Just reach out to us and let us connect you to the help and information you need. Some of the services we provide are federally designated, such as the Medicare and the Long-Term Care Options Counseling, fraud, waste, and abuse under the Senior Medicare Patrol. The Minnesota Board on Aging is our designated Senior Medicare Patrol, and the Senior Linkage Line is the designated state health and assistance program for Minnesota by providing counseling, education, and assistance. The Senior Linkage Line in Minnesota is the Aging and Disability Resource Center. We also have the Disability Hub and the Veterans Linkage Line. The 3 live lines and Minnesota Help are part of the Minnesota Help Network. This is a snapshot of the Senior Linkage Line's new website that is geared toward older adults and their caregivers. So please take a moment when you can and check it out. The Minnesota Healthcare Choices booklet provides comprehensive information on all Medicare options in Minnesota. To get a free copy mailed to you, you can call the Senior Linkage Line at 1-800-333-2433, or you can view and download it online at the healthcarechoices.com website, or also order a copy also. The online version of the Healthcare Choices booklet will be your most current and up-to-date version. Volunteering. There is so much work to be done to help Minnesota's older adults and their caregivers, and most of this work is a lot of fun and very rewarding. If you'd like to help, become a Senior Linkage Line volunteer. We provide training in a variety of tasks and opportunities. You could do fraud presentations, become a Medicare counselor, or provide office support. You'll receive mileage reimbursement, ongoing support, and the knowledge that you have made a difference. My co-presenter will now introduce you to the parts of Medicare.
Hello, I'm going to talk about the Welcome to Medicare process. Medicare is a federal health insurance program that began in 1965. It's basically for people 65 and older, but it's also for those under 65 with certain disabilities. And after 24 months of Social Security disability insurance, in the 25th month, you get some information in the mail to go on Medicare. It's also for people with ALS, or also known as Lou Gehrig's disease, and there's no waiting period for those people. And any age for people with the end-stage renal disease, that dialysis and kidney functioning problems. And it was never intended to cover 100% of medical expenses. There will be, co-pays and co-insurance. We'll get into that more later on. It also is not meant to cover nursing home, a lot of the long-term care services. A lot of people mistakenly think that Medicare will cover nursing home, but there are some certain circumstances, and we'll talk about that. So here's the Medicare card. You receive that from Social Security. And you can, if you're like on Social Security or the retirement or Railroad Retirement Board programs, you will be automatically sent some information, and you can send the card back if you do not want Part B. And most people stay on A because it's premium free for most people. We always say keep that card in a safe place, like you would a credit card. It's lots of information on there that people can tap into, that are doing scams and fraudulent purposes. It's only used to show the enrollment in Part A and B. Some people get confused and say, "Oh, I don't see my Part D for drugs on there," but will only show A and B, and it will also always show the same date. Even if you order a card down the road, it will say that initial effective date. We want to make sure you don't confuse it with your Social Security card, which is obviously another very important card. So it doesn't replace a Social Security card. So, all right. So these are the 4 basic parts of Medicare. We'll unpack it in a few slides here, but basically Part A is hospital, Part B is physician and clinics, durable medical equipment, and more. The Advantage plans are referred to as Part C, and prescription drug is Part D. So we'll talk more about that. So there are several options you can approach getting your Medicare coverage. Here it shows the Part A and Part B as a foundation, and then you can choose what's called a Medigap policy, also known as Medigap supplement. This pays out-of-pocket costs after Medicare does, and then it doesn't cover most prescription costs, so you have to get a Part D separately and a standalone Part D unless you have other creditable drug coverage, credible meaning as good as Medicare or better. And here's the second option. You'll see Advantage plans and cost plans. And they are similar in the way they cover your Medicare costs beyond A and B. It's just that Medicare Advantage plans, they contract with Medicare to administer or process the A through D. They often have additional benefits, and we'll talk about that more. Um, the cost plans, they are limited. There's only like 21 counties left that have a cost plan. They are a little more flexible. You retain your A and B, the original Medicare, but the cost plans can have a Part D for drugs separately, or it can be within the plan. So you have a little more flexibility that way. All right, next. So here's another breakdown of option 1 and 2. Again, that option 1 was the original Medicare and Medigaps. Medigaps tend to have higher premiums and lower out-of-pocket costs. A lot of people will, I've noticed, will say pay now or pay later with other options. Again, it's whatever Medicare will cover, then they cover the remainder in various number of ways. You don't have any networks with a Medigap. You can use any provider that accepts Medicare, and there's even like travel, you could be a snowbird, there's even some international coverage. And then you can buy a standalone Part D, as I mentioned before, because it doesn't cover those types of Part D prescriptions. And then there is underwriting outside of the Medicare open enrollment period. And underwriting just means you would have to go through a health screening. The option 2, the different types of Medicare health plans, usually they have lower premiums but then higher out-of-pocket costs like co-pays and co-insurance and that sort of thing. I kind of think of it as a scale. You know, the higher you pay the premium, usually the lower cost sharing, and vice versa, lower premium, higher out-of-pocket costs. They do cover additional benefits. I kind of refer to them as carrots. They want you to buy their plan, and sometimes they offer, like silver sneakers or some dental, and some eyewear or hearing aids. So those are things you'd look for in an Advantage plan or cost plan. They do have provider networks. They may require a pre-approval or referrals. So sometimes you can have higher costs or even pay the full cost of outside services that you get. They may or may not include a medical Part D. They mostly do have Part D included, at least the Advantage plans for sure, but all of them have that choice. And then there is no health screening with a cost plan or Advantage plan. So these are some of the questions to consider when you're deciding whether to enroll in Medicare. Do you work for a small employer? Do you contribute to the health savings account? And when will that coverage be ending? And you will need to enroll in Medicare yourself if you do not receive Social Security or Railroad Retirement Board benefits. In that case, you'll automatically be enrolled in A and B. But if you do not receive them, you have to contact Social Security or the railroad benefit. And so many people nowadays work past their 65th birthday. And so people are delaying Part B and joining Medicare at various stages past 65. So with the group health insurance, as I mentioned before, when you are currently actively working and your employer or group based insurance is offered to, and your employer has 20 or more employees, that's an important piece there, you can delay Part B. You have to stop your payments to a health savings account before enrolling in Medicare. That's because there are tax laws involved, because most employer plans are like high deductible, and that's where that HSA or health savings account is. It's a tax exempt account, so you get a tax benefit for those pre-tax dollars. And so that's why once you go on Medicare, Medicare is not a high deductible plan in itself. So, so you could face tax penalties if you continue to contribute. You can use your health savings account, however, that you've built up to pay, Part B premiums, Advantage plan, cost plan premiums, the co-pays, that sort of thing. The one thing you can't pay is a Medigap premium. That's just one thing that kind of falls through the cracks. You could lose your employer-based group health insurance if you do go on Medicare in some cases. Most people can get into Part A, though, as again, it's premium free for most people. If you do enroll, you do not need that coverage. It would be duplicative if you were on Part B. And then also, there is a premium that comes with Part B. It's $148.50 in 2021. And there are additional costs we'll talk about later if you're higher income. And then the other thing, if you start Part B, that starts a clock ticking for the 6-month guaranteed issue right for Medigaps. So you don't want that to waste and go away if you get that going and start paying for Part B unnecessarily. Okay. So when you and your spouse decide to no longer work, you have an 8-month, what's called a special enrollment period, or SEP, where that starts when your group coverage ends or you stop working, whichever starts sooner. You can get into COBRA benefits, and that is takes the place. It's like your actual employer insurance, but the one problem with the COBRA is that it doesn't count as employer insurance, and so that would result in having a Part B premium penalty if you delay that. So it has to be current active working, and not retiree. And so, and when you do apply for Part B down the road, you would work with your HR department or benefits administrator, and you need to complete several forms. It's CMS 40B and CMS L564 for your information. And CMS stands for the Centers for Medicare and Medicaid. Okay. And now I'm going to hand it over to my coworker, Karen, to talk about enrollment periods.
So the next few slides, we're going to talk about the different types of Medicare enrollment periods. There are actually about 5 different periods that we'll go over. The first one here is the initial enrollment period, and that is for people who are age 65 and older and certain disabled people under the age of 65. Typically, this enrollment period is triggered on your 65th birthday, and it starts 3 months before, the month of, and the 3 months after your 65th birthday. And then for people under the age of 65 with a disability, once they have been actively receiving Social Security disability benefits for 24 months. On that 25th month of disability, they will become enrolled in Medicare. If one note on this is if you haven't been receiving your Social Security retirement check yet, and a lot of people are delaying that because they're wanting to wait until their full retirement age. If you are not already receiving that at least 4 months before you turn 65, it is your responsibility to contact Social Security to do your enrollment into Medicare A and B. It will not happen automatically for you. Another one of the enrollment periods we're going to talk about today will be the general enrollment period, and that runs from January 1st through March 31st of each year. And during this time, anybody who hasn't enrolled in Medicare when they first should have can use this enrollment period to enroll. The open enrollment period, which runs from October 15th to December 7th annually, is the one where you can go and make changes to your Medicare health plans or your Medicare drug plans, and those changes will be effective on January 1st of the following year. The special enrollment period is for certain circumstances that can qualify a beneficiary to make changes, such as their plan might terminate, maybe they move out of their service area, or they're losing coverage that they had through their employer while they were actively employed. And the final enrollment period on the screen here is the Medicare Advantage enrollment period. And that runs from January 1st through March 31st of each year. And during this time, beneficiaries can return to original Medicare and choose a Part D drug plan, or they can choose a different Medicare Advantage plan. But they have had to have started the year out in an Advantage plan in order to do this. And those changes would become effective the first of the following month of the enrollment. So if they enrolled in January, the change would take place in February. And if they enrolled in February, it'd take place in March. So this is kind of a snapshot of what that initial enrollment period looks like. So again, when people are first eligible for Medicare, they have this period, which is 7 months, and it starts the 3 months prior to their 65th birthday. It again includes their birth month, and then it extends the 3 months after. It's important to enroll during this time. Beneficiaries who do not enroll during this initial enrollment period may incur late enrollment penalties and be without the coverage that they need. So beneficiaries who are eligible for premium-free Medicare Part A can enroll in Part A at any time after their initial enrollment period begins without a penalty. So if the person delayed enrolling in both the A and the B during their initial enrollment period, they could still enroll in Part A after that 7-month initial enrollment period is over, but Part B, they would have to wait. And we'll talk about those other times when you can enroll in Part B on the next few slides. Thank you. So again, this is sort of also another snapshot of this initial enrollment period. If you sign up during the first 3 months of your initial enrollment period, your coverage will start on the month that you turn 65, unless, of course, your birthday falls on the first of the month. And then your Medicare Part A and B will begin on the month prior to the month that you turn 65. If a beneficiary enrolls in Part A and or Part B, the month that they turn 65 or during the last 3 months of their initial enrollment period, their start dates will be delayed. So, for example, the month following the month of enrollment, if enrollment occurs during the 4th month of the initial enrollment period, then that's when your enrollment with Medicare begins. An example will be, let's say if a beneficiary turns 65 in June, but waits until September to enroll, the last month of their initial enrollment period, the coverage would not begin until December. So it would delay that Part B effective date out 6 months from the month that they turn 65. So it's very important that people think about this when they're deciding to enroll in Medicare. And a reason why somebody might enroll in those last months might be because they're still covered under an employer health plan, either by active employment or COBRA. And so they can stretch that out just a little bit longer. It's important to always talk with Social Security before deciding to delay enrollment into Part B, because you don't want to make an error at this time and end up with a potential penalty later on. And to also remind you that people who do enroll in Medicare Part B will pay a monthly premium for that. So this is the initial enrollment period for people with disability. It's very similar to the initial enrollment period for other people that are not on disability. It typically begins on that 24th month. So you have 24 months of receiving active disability payments, and then your Medicare Part A and B will begin on that 25th month. So, of course, beneficiaries who have ALS, as our co-presenter mentioned, or Lou Gehrig's disease, would begin Medicare immediately. Those with end-stage renal disease can begin collecting Medicare generally 3 months after a course of regular dialysis begins or after a kidney transplant. At this point, they're automatically enrolled in Medicare A and B and must accept or reject Part B. If a person on disability rejects Part B, a Part B penalty can apply until they turn age 65, and then the penalty would end. You should not have to contact anyone. You should receive the package in the mail 3 months before your coverage starts with your new Medicare card. There will also be a letter explaining how Medicare works and that you are automatically enrolled in both A and B. If you get Social Security retirement benefits, your package card will come from Social Security Administration. And if you get railroad disability, your package and card will come from the Railroad Retirement Board. The general enrollment period, which is from January 1st to March 31st of each year, is for those people who did not enroll in Medicare when first eligible. And the coverage will not begin until July 1st when they use this enrollment period. So if a beneficiary is on Social Security disability insurance, did not take Part B when first eligible, and now enrolls during the general enrollment period, will in most situations have a Part B penalty, but it will end when they turn 65. If the period of not having the Part B is less than 12 months, then there is not a penalty. If the period is 23 months, then the penalty would still only be 10%. It must be a full 12-month period. So for example, if a person became eligible in September for Medicare A and B, but did not take the B, the person could enroll during the general enrollment period and would not have a penalty because it has not been 12 full months since first eligible. So who would use this general enrollment period? Well, typically it's for beneficiaries who declined Medicare Part B during the initial enrollment period, or maybe they canceled their Part B without having other coverage, or they did not enroll in Medicare within their 8 months of current employer union coverage ending, which would have been their special enrollment period. My co-presenter will now go over some of the decisions you will need to make.
And now we're going to talk about the various kind of categories or topic areas that's going to help you make your Medicare decision. Karen already went over the enrollment in more detail, but we're going to talk about how you should get your Medicare benefits, and then the various types, Medigaps, the Advantage plans, and the Part D, in more detail. And then we always remind people that it is good to do, even after you pick a plan, do that annual review of coverage, because formularies change, pharmacies change, the plans do reorder some of the benefits in their plans. So, all right. So, original Medicare Part A. As we talked about, that's premium free for most people. And the main area it covers is inpatient hospital. And it mentions not observation. So, and that is a key piece. A lot of times when you're in the hospital, you think, well, I'm in an inpatient, but there is a status that is decided upon by your physician. A lot of time you are under observation status for a while. And where this comes into play down the road is if you need to go to a nursing home after a qualified hospital stay, is what they call it, um, and you're in observation, then you would pay out of pocket in the nursing home. Whereas if you are an inpatient or a qualified hospital stay, then Medicare will step in and cover some of that nursing home stay. All right, and then skilled nursing facilities, it's very limited benefits. Again, it has to be under certain circumstances where you need skilled nursing services, medically necessary, and it only covers, it's often $0 copay to you for that first 20 days usually. And then home health care, again, that's under certain circumstances. It must be ordered by a physician, medically necessary, receiving skilled nursing services, and from a Medicare approved provider of home health care services. Hospice, that's an area where, of course, you and your doctor come to the decision that you may only have like 6 months to live, and so you are eligible for some services under Medicare's hospice program, and then some blood coverage. Okay. So these costs that I'm going to talk about is related to original Medicare. So the Part A hospital deductible is, as you can see, $1,484 per benefit period, and there can be more than one time you go to the hospital and could be charged this. Now, however, if you have secondary insurance, a Medigap, Advantage plans, cost plans, they often have benefits that cover this, although that can is a wide range there too. But just in basic, this is for under original Medicare, and then it goes up to, so on the 21st day, there's the 65 days to 90 days, 61, I'm sorry, then it goes up to the 371 per day and on up, and there is a lifetime reserve days that you can cap out at. The skilled nursing services, when I started to say 0 through 20 days is usually covered in most cases, but in the 21st day to 100, then it's $185.50 for per day. The home health care, you pay $0 if you are qualified, as I spoke about before. And the hospice services are $0 as well. You may have some $5 copay for prescriptions and for pain relief and that sort of thing, and then 5% co-insurance for respite care. Now, we've heard some hospice programs don't charge that, but that they could charge that. And mostly, like I say, these aren't drugs that are for kind of curative conditions. They are mostly for pain relief. And then there is the blood. The first 3 pints are covered unless you are a member of a blood bank or someone donates blood on your behalf. Okay. So the original Medicare Part B, this is a list of services that are generally covered. You know, the physician services and clinic coverage, the outpatient hospital services, and when I talked about the observation, the difference between inpatient and outpatient. Preventative services are mainly things that are covered by Medicare at 100%. you know, things like mammograms and cardiovascular screenings and diabetic uh, health services, that sort of thing, the screening at least. Ambulance, you must go to the nearest hospital, and it has to be an emergency. It can't be just a transport for people. Um, the different therapies we talked about, the occupational, speech, and physical, or we known as OT and PT, that sort of thing. That is covered by Part B. There is some limited prescription drugs that fall under Part B that are, not in the Part D as in dog category. A lot of times they involve infusions and drugs that you have to go to the doctor or hospital to have administered. Um, there is some coverage for blood and lab services. And then you hear about durable medical equipment. Those are walkers and orthotics and things like that. Um, and Medicare Part B covers that. Again, it has to be doctor ordered and medically necessary. And then a newer service that's covered is acupuncture for chronic lower back pain. That's new in 2020. And here are some outpatient services that require prior authorization. This change was made because the Centers for Medicare and Medicaid, known as CMS, they have seen a significant increase for the number of these services being performed. And so you can take a look at that list and work with your doctor on that. So the original Medicare Part B cost sharing, as you can see, it's mainly 20% in a lot of cases for the person, and so Medicare covers roughly 80%. The one thing at the first of the column, the monthly premium, as I mentioned before, is $148.50 for most people. The annual deductible in this year is $203, and that's just once at the beginning of the year, the beginning of when you access your Part B type services. And some Advantage plans and cost plans do cover this, but you have to be careful and when you're choosing, because some don't. Again, we talked about preventative services. They mostly have no cost sharing. I think the premise behind that is, trying to avoid the train wreck, so to speak, and try to catch these conditions and diseases before they become a problem. And acupuncture, the chronic lower back, there's certain conditions that must be followed for acupuncture to be covered. And I mostly covered most of the rest of this. Blood is the first 3 pints, unless you have someone who donates on your behalf. And then we come to what's not covered by a Medicare. The comprehensive annual physical is, the standard thing you think about going to a physical every year. Well, when you're on Medicare, and this is when Part B starts ticking, the clock starts ticking, you have like 12 months to get a welcome to Medicare visit. That is mostly a preventative visit and kind of establishes a baseline. And that is a more hands-on type of appointment. After that, then it's called welcome, or not welcome, but wellness checks. So when you are making an appointment to see your doctor every year, you have to make sure you don't say, I want a physical, because Medicare does not cover that standard type physical. There are some Advantage plans that, however, that do cover that. And then Karen will talk more about the Medigap. There's certain riders that might help cover some of those costs. The hearing aids, dental care, and eye exams, some of those routine things, they are not covered by Medicare. Um, they, but again, the Advantage plans may offer a lump sum or a discount or some dental services, a little teeth cleaning or X-rays or certain procedures, and you have to look at what plan you're getting into and see what the coverage is if that's an important thing to you. Certain eyeglasses are covered by Medicare if you have cataract surgery. So that's another kind of exception to this rule, but we're talking routine. Most care traveling outside the United States is not covered by Medicare. I think there are some limited exceptions if you're on one of the borders of the country and the nearest hospital in an emergency is in Canada or Mexico. Long-term care, just that custodial care, is definitely not covered. It's just the circumstances I described earlier if you have skilled nursing facility or services needed. And then the routine foot care, only if you have like diabetes and that affects your circulation, that sort of thing. That is when you would be able to get some foot care covered by Medicare. So now I'm going to hand it over to Karen to talk about Medigaps.
Hi again. We're going to talk about over the next few slides Medigap policies. And Medigaps work with original Medicare A and B, and they help cover most of the copays and deductibles of original Medicare. They're sold by private insurance companies. The plans basically all offer the same coverage. The main differences are going to be in the premiums and customer service. The most important thing that you want to think about and know about right now is the 6-month guaranteed issue period. This guaranteed issue period is triggered from your effective date with Medicare Part B. And during this time, you have those 6 months, you can enroll in a Medicare supplement or a Medigap without any health screening or an underwriting. If you wait and enroll beyond that 6 months, then the insurance companies can health screen you and they can either accept you or deny you coverage into their plan. Beneficiaries who are on Medicare who are under the age of 65 will get another 6-month open enrollment period when they turn 65. So they'll have, again, another 6-month guaranteed issue period to enroll in a Medigap without a health screen or be denied. These plans are transportable to other states. So if you did have a Medigap and you moved your residency to another state, you would be able to keep it. However, the premiums could either go up or go down based on that state's premiums for that plan. In Minnesota, we have basics with riders. We have extended basic and select policies and just a few alpha plans, and we'll talk about those on the next slide. So the Medigaps in Minnesota, the basic with riders. So the basic policy covers the Part B 20% coinsurance, skilled nursing facility, preventive care, and they also have about 80% foreign travel coverage. You can add riders to the basic plan that will cover the Part A inpatient deductible, some preventive services not covered by Medicare, like perhaps a routine physical or routine eye exam, up to a certain dollar amount of about $120. They also have cover excess charges. Those charges would be occur when seeing a provider who bills above the Medicare approved amount. Usually in Minnesota, we don't see this because we have a limiting law where most providers cannot bill more than that. But you may run into that if you travel to other states or with some durable medical equipment suppliers, for example. The extended basic policies that we have in Minnesota include everything I just mentioned above, but they offer 80% foreign emergency travel coverage up to $1,000 maximum out of pocket. And then the plan would pay 100% for those emergency services. For example, if you were traveling in Canada and had an emergency and went to either a clinic or a hospital and you had an extended basic policy, the maximum you would pay for that emergency services is $1,000. I want to make a note that there is no provider network with basic and extended basics. You may go to any provider who accepts Medicare anywhere in the US. The Medicare Select plans are similar to basic and extended basic, but you do get your best coverage if you see providers within their network. But those select plans can also include all of the coverages under the basic with the additional riders. And then you also have an option of having a retiree as your supplemental coverage to Medicare A and B, but it's best to always check with your HR plan to see how that's going to work with original Medicare A and B. Medicare Part C, which is also known as Medicare Advantage plans, are offered by Medicare-approved private insurance companies. They follow the same Medicare rules. They have to provide a minimum of the coverage and services approved under Medicare, but they can offer additional benefits, those carrots that Gloria was talking about, like hearing, dental, and vision. The plans may offer other supplemental benefits to certain people with chronic conditions. So you always want to check with your plan after enrolled to see what might be available for you. It's another way to get your Medicare benefits. They can include the A, B, and most often the D coverage, your prescription drug coverage. They're the only payer of your Medicare bills, not original Medicare. You get your best coverage by using the plan's network, and you cannot have a Medigap policy or any other type of Medicare supplement if you're in a Medicare Advantage plan. And when you enroll in an Advantage plan, please keep in mind that you will always still pay that Medicare Part B premium, no matter what type of plan you are enrolled in. So these are the types of Advantage plans that you can have in Minnesota. We have health maintenance organization plans, and they're a managed care plan that's been approved by CMS to provide all Medicare services for the enrollee. The only payer of services can be the HMO or the health maintenance organization, and you usually need to use the provider network for coverages of these services. Another one that is available to you is called the Health Maintenance Organization with Point of Service. It's the same as the previous one we talked about, except it allows an enrollee to see providers out of network and get coverage, though at a higher cost sharing. The Preferred Provider Organization is a plan where beneficiaries pay less if they use a network provider. You can see any provider, but you will have higher out-of-pocket costs if it is a non-participating provider. The plan, again, is the only payer of the services. And then we have some private fee-for-service plans. With these, you may go to any Medicare provider, but the beneficiary must make sure the provider will accept the terms of payment of the plan, and the plan decides how much the beneficiary must pay for those services. And then we have Medicare Advantage medical savings accounts, and these are high deductible Medicare Advantage plans that include a medical savings account similar to a health savings account. But these plans do not include Part D, so you would need to enroll in a standalone prescription drug plan. And then we have special needs plans, and those are our plans that mostly serve beneficiaries who have special needs. And in Minnesota, the special needs plans provide coverage for beneficiaries that are enrolled in medical assistance. And again, this plan is the only payer of services. So the Medicare Advantage and Medicare Part D have an open enrollment period, and this period occurs each year from October 15th to December 7th. And during this time, beneficiaries can review health and drug plans and make changes if needed. And the new coverage will begin on January 1st. If a beneficiary did not have credible coverage, meaning it was as good as or better than Medicare's drug coverage for 63 or more consecutive days, a penalty of 1% of the national base premium, which changes annually, is applied. So the penalty can increase annually based on this amount. The penalty lasts a lifetime. And the penalty is 1% for each month they've gone without that credible coverage. So if a person went without coverage for 8 months, there would be an 8% penalty times the national base premium, and then that is added to the monthly drug plan premium. And one final open enrollment period that is available for Medicare beneficiaries is the Medicare Advantage open enrollment period, and that runs from January 1st through March 31st of each year. To use this enrollment period, you must begin the year enrolled in a Medicare Advantage plan. And during this time, you can switch to a different Medicare Advantage plan. You can return to original Medicare and purchase a standalone Part D drug plan. And should you do that, you would not have a guaranteed issue right. So the Medigap could do a health screen on you, and they may either accept you or deny you. Another type of policy that you have available to you in Minnesota is called a Medicare cost plan. Typically, these plans offer no health screening, and they usually have open enrollment anytime during the year if the plan is accepting new enrollees. You still keep your original Medicare A and B, and the policies can either include Part D, or you may purchase a standalone Part D plan. They're only available in 21 counties, and if you move out of that plan service area, you would need to find a new plan in that area. And so this is kind of a map that shows you which counties these cost plans are still available in. And so again, if you live in one of these counties, you can purchase a cost plan. If you move out of that county, you would have to look at either a Medigap or a Medicare Advantage plan. But even though you purchase a cost plan living in one of these counties, you're still able to see providers anywhere within the state of Minnesota. And now my co-presenter will talk about Medicare Part D.
So Medicare prescription coverage is obtained through what's called Part D. It is an optional program and offered through private plans. And it, even though it says optional, as Karen alluded to earlier, if you don't get Part D when you could have, then you do face a late enrollment penalty, as she described. You can get a Part D through either a standalone Part D or within a Medicare Advantage plan or cost plan. They do mostly have monthly premiums. There are a few Advantage plans, however, that have $0 premium, and it does have the drug coverage in them, so there are a few options that way. Each plan has a formulary list, which is just their list of drugs that they will cover, and this can vary from plan to plan and even change from year to year. So that's hence we say do that annual review of your plan. So these are the kind of the subject areas where, the coverage areas we're going to talk about in the next few slides. Most plans have a deductible phase where you pay out of pocket for the first portion of the plan, and it varies from, if you have some extra help and things like that, we'll talk about. Initial coverage phase is when you do meet that deductible. It goes into the initial phase. Then after that, you meet another threshold, and it's like a coverage gap. This has changed over the years, but there still is. There used to be a thing you might have heard of as donut hole, but that is over with, the larger percentages, but there is a coverage gap phase here. And then you get to the catastrophic coverage where you pay so much out of pocket, and then your costs go down. All right, next. So here's a breakdown of the standard benefit where you don't have any extra help, or LIS, which is low income subsidy. The premiums can vary plan to plan greatly, and the benefits and tier levels and things that you hear about with each plan, that they decide what drugs fall into the various tiers. So that first column is in 2021, the plans can apply a deductible of $445. They don't have to, but they can go up to that. You will see an occasional $0 deductible or some variation, $280, $350. I've seen various kinds. Then when you meet that deductible, you will pay 25% or less. And the plans do vary on, on these copays, and that you will find, especially with the enhanced Part Ds, they can vary a lot, but they can go up to 25%. And then, I mean, you would pay 25%, and they pay 75% generally. Also, when you reach that 4,130 figure, for standard benefits, you would still continue to pay that 25%. Then when you hit that catastrophic, that $6,000 figure, you would pay either 5% or a copay of $370 or $920 for brand names. $370 would be for the generic. So that's that breakdown. Next. So then there's a partial extra help or low income subsidy benefit. You'll see that that deductible is a lot slimmer margin there, as they can go up to $92 for a deductible, where you pay 100% for the drugs. And again, there are some plans that are zero, that you would they choose to do it that way. But overall, with the partial extra help, you can have lower premiums, lower deductible, lower coinsurance, and then sliding scale premiums based on your income, and then what is determined. You have 25%, 50%, 75%, and even 100% partial benefit. The program is administered by the Social Security Administration, and just available for people with limited income and assets. This year, for single, it's like 1,615 for single people. That's gross monthly income. And for a couple, it's 2,175. So that just gives you an idea of people don't have to be rock bottom income to get these programs. Okay. So here's the full extra help. And as you'll see, there's no premiums if you get a benchmark plan. And there's certain benchmarks every year they change, and they are typically under a certain premium per month, where that low income subsidy will cover the whole amount. If you choose like an enhanced plan or some other plan non-benchmark, you would pay a little difference. The low income subsidy will pay up to $30-some a month, and then you would pay the difference. But sometimes people will pick that because it has some better coverage, so you do still have that option. There are no monthly caps on copays, no deductible, and no coinsurance. And as you can see, that bar goes all the way across up to the catastrophic level. There are two categories within the full extra help. If you are under 100% of the federal poverty level, that's what that FPL stands for, you would pay $1.30 for generic and no more than $4 for a brand name. And this doesn't matter what plan you go on, if you're in a standalone or if you have prescription coverage within an Advantage plan or cost plan. The low-income subsidy follows you to whatever plan you're on. If you're over 100% of the federal poverty level, then you would pay $3.70 for generic and $9.20. So yeah, that's all on that one. So this is what we had talked about before. This is when you earn more, you pay more for certain premiums, and it'll show the column Part B as a boy premium and Part D as a dog premium. And this is the income-related monthly adjustment amounts, or otherwise known as IRMA. And as you can see, if you like a single tax filing status is if you're under $88,001, then you would, and a couple under 176,001, you would pay that standard 148.50 premium for B, and then the plan premium for D would be whatever the charge is, the basic charge. And then just going on up the scale, as you can see, it increases on up the scale, and so it would be, for people over 88,000, for instance, it would be 148.50 plus that 59.40. So, and of course, the higher income you have, the higher you pay. You can get this adjusted if you do have a loss in income, you lose a spouse or you retire or anything. You can fill out a form through Medicare, and this can be lowered over time. You're not just stuck with this forever if you do start out having a higher income. Okay. And so these are the things that you need to consider when you are deciding, and we've kind of covered some of this. So if you go with the original Medicare, are you going to purchase a Medigap policy? As I said before, these are more expensive, but then you don't have very many bills afterwards, so that a lot of people like that. They don't want to worry about having a bunch of co-pays and co-insurance. Do you need that Part D, or are your prescription drugs covered by a creditable plan? That means, the Veterans Administration, if a vet has VA drug coverage, or Indian Health Service if you get your drugs through those kinds of resources. Those are considered creditable. Can you afford the premiums? Sometimes you start out with higher income and might go with that Medigap, and then you retire or a spouse dies, and we've had people call and switch to an Advantage plan after a certain time, even if they kind of didn't want to, but they just can't afford the Medigap premium anymore. And I think Karen mentioned, if you go out of a Medigap, you really can't go back into it without a health screening typically. And then just remembering, if you have employer group health insurance, then you can delay that Part B, as we talked about. With the Advantage plans, and this includes cost plans as well, you have to make sure your providers participate. We talked about those networks. And are your prescription drugs covered? The different formularies, you have to make sure that covers your particular drug. And then do you travel? Different Advantage plans and cost plans cover travel in different ways. They mostly all do cover like an emergency at a certain percentage. And those extra benefits, is that important to you to have silver sneakers or gym coverage. Um, you know, some people want those dental extra services as well. So, and then basically, can you afford the premiums and the cost sharing? All right. So you can get extra help with Medicare costs. We already kind of went over the extra help, the various, partial and full, and you would apply through the Social Security Administration, basically. And we at Senior Linkage Line can help you do that. We have the access to the computer, and you can feed us the information, and then that is sent directly to the Social Security program. You can get extra help through a Medicare savings program, that middle column. That is going to pay, most of these programs pay for your Part B, as in boy, premium. And but the qualified Medicare beneficiary, that has a little more coverage. It has whatever Medicare covers, that program will cover copays and coinsurance and deductibles and that sort of thing. And when you qualify for any of these programs, the QI, the QMB, and the SLMB, and you can see what it stands for there, then you will automatically be deemed eligible for this extra help we talked about for prescription meds. And then the medical assistance, that is known as, that's what Medicaid is called in Minnesota. We call it medical assistance here. And you can get that, you can get straight MA, as they say, and you can get it with or without a spend down. The spend down is like a deductible. So if your income is higher than what the medical assistance eligibility rate is, then you would just spend that down like a deductible to a certain point out of pocket for Medicare or medical assistance related items. Medical assistance for employed persons with disabilities, or MAEPD, is a program. It helps encourage people with disabilities to get a job if they choose and are able. And you can earn as little as $65 a month, and as long as it's legitimate, on the book, so to speak. And then it acts as a sliding fee. And so, the more you make, the more you would pay for your insurance, but it is a very good deal because it is medical assistance. So, and it can include the extra help once the spend down is met. I'm backing up to the medical assistance with the spend down. I mean, once that spend down is met, then you would get the low income subsidy for the remainder of the year. Okay. And so, new to the scene federally in Minnesota, there are exciting new programs to help with diabetes medications. It's important to know that 1 in every 3 Medicare beneficiaries has diabetes. So this is a huge problem for people, and those insulins can cost so much. And so let's talk about the several programs that come up. So they're let's see, the one is called Urgent Need Program. This is a Minnesota Insulin Safety Net program, and that is for people who are not on Medicare, and that it's like a 7-day, so you have to have a 7-day supply or less in order to apply for it. And then there's the Continuing Need Program, and we'll get more details in the next page. So the Urgent Need Program as I said, you'd have to have 7 or less days supply of insulin. You must have a current prescription and paying more than $75 a month for your insulin. And urgent need programs, as I said, are not available to Medicare beneficiaries. The continuing need program, however, you must have income at or below 400% of the federal poverty level, and that's about 51,000 for a single person, for example. You can't be eligible for health care through any federally funded program. And then people with Part D may be eligible, but you have to spend $1,000 out of pocket first. With the urgent need program, it's a one-time 30-day supply. You must get it from the pharmacy, and you pay $35 copay. With the continuing need program, the manufacturers will supply the insulin up to 1 year. And you can renew this program annually. You'd pay no more than $50 for a 90-day supply. People with insurance may be referred to a copay program known as like a manufacturer's coupon or patient assistance programs. All right. So this is where to go for help. There's the senior linkage line. Disability Hub used to be called the Disability Linkage Line, and the Veterans Linkage Line are kind of three partners. We all help each other. Like if someone from a veteran called us, we would help to a certain point. But then if it gets more into the expertise of veterans, we would refer them on. And same with disability. But we do overlap and help each other. Medicare is the main resource. At Medicare.gov is a very important website, and that's where the tool we use, the Plan Finder tool, and that gives you the information about your particular drug costs, and we can put in, your zip code, your prescriptions, the dosage, and how many times a day you take them, and your pharmacy, and then it narrows down all the plans in your zip code. So that's a very important thing that we at Senior Linkage Line do every day. And then the Social Security Administration, there's the SSA.gov, and it's an important resource when you're starting out, your Medicare especially. And so those are the resources that when you have any questions, you can contact us, as Karen said, through chat, through phone, and we'd be happy to help you from Monday through Friday, 8 to 4:30. And thank you very much.